June 29th, client came with the chief complaint with the lower back pain on the right side, and secondary complaint is the upper leg on the same side on the right. Hi,
Hi, how are you?
I'm good. How are you?
Good.
Can I have consent to do the assess and treatment with the osteopathic
Sure, please.
therapy?
Yeah.
Thank you. So before doing it, I'd like to check the blood pressure first. So what is your regular blood pressure number?
120/80.
120/80.
Since right now you didn't eat anything, so I'm not sure. Maybe a little bit low.
Hopefully doesn't affect your blood. Let's see. Good. 120/80. I'd like to check on the other side. Can I have
Sure.
your right one? I will remove all the air first. Good. 120, and then about 85. And I have on the other side. Check it. You can put your elbow down and relax. Can you turn your body toward me? Thank you. Okay, 125 and 83. No more? That's good. So from now, I'd like to do the gait and posture assessment. Will you be able to remove your shoes?
Sure.
If you stand end of the table, and then jiggle, jiggle, jiggle your body, make yourself comfortable. Okay. Will you be able to come toward to me?
Okay.
Walking naturally, doing good. And then you can going back, and can you stop and turn around and coming to me? And you can turn around and walking away. Okay. I'm doing the posture scan. Will you be able to jiggle your body to make yourself comfy?
Okay.
And then stand straight with what you're thinking about it. So good, naturally. Checking the ear level, shoulder. Looks good. Arm level is good. Can you turn 45 degrees, looking toward the plank? Okay. So there is less curve with the cervical area. 45 degree. Can you turn it again? Thank you. ear level, shoulder level. Looks good. Your hand. Can you turn 45 degrees looking at the window? Good. Yes, still I'm finding cervical area, upper body has less curve, but the rest of things looks great. Thank you so much. You can turn back. Awesome.
Thank you.
Do the heel drop. Can you lift your heels up and drop it sudden? How do you feel?
No feeling. Pretty good.
No pain,
No
no
pain.
tingly.
Mhm.
This time we are going to do the flexion, global flexion, bending all your joint, front side. Keep the heels down. How do you feel?
A little bit tight.
Yeah, you can go back to the neutral. Just muscle tightness.
Yeah.
Okay. This time we are going to do global extension. Can you open up everything? Your chin, chest, and arm. How do you feel?
A little bit tight, but comfortable.
Which part of the
Upper back.
upper back is a little bit tight? You can go back to the neutral. So this time we are going to do hip circumduction. Can you use one leg folding back and folding in? And can we do the other side? Back and in. Let's do the shoulder circumduction. Circling back and in. The other side, back and in. Will you be able to do your neck circumduction? Chin down all the way to the other side. And then opposite side circling to come to me. And then if you turn around looking forward to the exit side,
Sure.
I'm going to put my hands on your wrist and you can cross your arms on the chest. I'm going to check your iliac crust. And I can see on the right side slightly high. And then will you be able to bend your neck and trunk and up? Can you try to neck folding first and all the way bending down toward to your toes? Good. Good job. Yeah, I could not see any upslip. So I'm going to check the cervical assessment. Neutral position. I didn't find any side bend. Will you be able to flex a little bit, folding your neck and yeah, good job. I didn't find any side bend. Will you be able to extend, looking up to the ceiling? Good job. I didn't find any curve or side neck. That's good. This time I'm going to check the deep circus. Will you be able to bend down? Trying to find the PSIS. Okay, try one more time. Okay, up. One nickel in, one nickel out, deep circus. And from deep circus on the right side. Then let me try to check your innominate. Can you turn toward to the window? Will you be able to put your hands on my shoulder? Then bend your knees up. Try slowly down. Can you try one more time? Up and down. PSIS. Then there is ASIS. I can see right side is slightly half inches anteriorly tilt. Can you turn 180 degrees? Okay, will you be able to put your hands on my shoulder? Thank you. And will you be able to lift your knees up? Slowly up and down. Okay. is done with the standing assessment. So now you can have a seat, come around the table, and you can sit on the table. Will be great for the next assessment. How do you feel with the stool? Is it too high? Is it right? Okay, awesome. So this time I'm going to do the seated assessment with seated assessment. Let me see. So I notice your shoulder level is same with seated position. And then I would like to check. Or will you be able to do trunk rotation? Shoulder, then turn to the left, and turn to the right side. How do you feel?
Okay.
Which side? Any of side is more tighter?
Right side tighter
Right
maybe.
side feel more tighter. Okay. I'm checking the hylium is gone. Can you fold your neck toward to your belly button and bending your whole back trunk and up? Can you bend a little bit further? I just want to see the up slip. No up slip. Good. And then I would like to check the deep circus. Can you bend down one more time? I just want to find pin size. Okay. Up. Good. And with the deep circus. And I would like to do the spinal assess. Neutral position. Can you bend down toward forward? This time, can you look up the ceiling? That's good. I didn't find any side bend. Okay. Before we move, actually I missed the one of the standing rotation. Can you stand up? And then, yeah, if you stand in front of me, I will just quickly check the rotation of the trunk. Will you be able to put your hands across your chest and then turn to the right? And turn to the left. How do you feel?
Feel
Same with the right turning more tight muscle? Or is the same?
not much
Side.
different.
Not that much different with standing.
Yeah, seems so.
Okay, but when you sit down and do the trunk rotation, you said you have right turning has more tightness of on the muscle.
Yeah.
Okay, good to know. If you sit on the table, I'm going to do a quick neurological reflection test. Will you be able to sit? Okay, so it's good to hang your legs down there because the client complained about the lower back pain and also upper femur area tightness and stiffness of the muscle. I do like to check the reflection test. So this reflection test, I'm going to gently hit your tibial tuberosity. It'll be good if you're looking at somewhere else, maybe looking at the light or whiteboard. And then it's checking muscle involuntary action. Yeah, I'm going to check both sides. That side seems normal. I'm going to check on the right side. The tuberosity. I feel the both of sides has slight movement of the reflex. So this
The
time, prone position assessment. Can I have consent to stand between of your leg to
Sure, please.
check your spinal?
Okay.
Thank you. So with that, I would like to check the deep circus. So I can feel PSIS, one little in, one little up. See the deep circus on the right side. Will you be able to stand up with your elbow and relax? Seeing deep circus on the right side. Can you go down? Okay, good. So I'd like to check your sacrum. And also coccyx. I can feel some of the things stuck on the right side. And I'd like to check with the deep inferior lateral here. Lateral angle. Okay. Will you be able to stand with your elbow? Good. So Dilla is okay. And I do like to check with the spinal assessment with the lie down. Yeah. Neutral. Good. Will you be able to stand with your elbow? One more time. Thank you. So I did not find any curved side bending. So it is good. Will you be able to go all the way up to the table? So this time, I'm going to do the functional assessment with the hip flex with legs straight up. You can do relax. You don't need to do anything. It's the passive straight up. Get on the other side. Good. I'm going to do with bent knee. And also knee flexion. Medial rotation. Lateral rotation. Good. Do the same thing on this side. Knee flexion with hip flexion. Good. And then just knee flexion. And here. And lateral rotation. So I'm going to do the abduction. And from the other side. Abduction, adduction, and abduction. Adduction and abduction. Good. Yes, ma'am. I'd like to put some Kleenex under your armpit to check. Thank you. And you can put your arms down also. And underneath you can close it also. After checking assessment, I will remove that thing. I'd like to do the thermal diagnose scan to see if she has any heat difference with lower body or upper body. You can just be relaxed, and then it'll be great if you close your eyes. I'm going to put my hands 1 or 2 inch above his skin, her skin, to check any difference of the temperature. You close your eyes. So I did not find any significant temperature changes from her body. Can I just check your Kleenex? So left, right, both of dry. I think she's doing good. With the supine position, I do like to check her pubic tubercle. Can I have consent to touch your belly
Yes.
to find the pubic tubercle? So I can do this way, but also I can ask to the client to, can you able to touch your pubic tubercle? Okay, I'm going to put my hands on the top of your hand. And the level is even. And then can you show me where is your belly button? Right here. Am I touching right? That's good. So I'm going to check in flare and out flare. So there is ASIS on this side, and on left side ASIS. Touch and measure it together. I just noticed on her right side is out flare and left side is in flare. Slightly, not huge difference. So this time I'm going to check the last action of illumination. You come all the way off the tip of your shoulder. Extension of the shoulder the glenohumeral joint. Can you go on all the way to the other side? And then I'm going to check the other side extension. Then how do you feel? You go back to the normal, and I notice her left side of the glenohumeroid extension is a little bit tight because her shoulder is a little bit, she has a little bit tight muscle on the left side. So we're going to do the T-line checking. Will you be able to come down a little bit? Thank you. Good. I'm checking T-line checking with one side. Good. The other. You okay? Oh, yeah. You're doing good. Good. That was lower body T-line checking. Do you have any concern with your shoulder?
No.
So then, is it okay me putting your hands up to check the T-line?
Sure. Can I have the other hands too?
Okay. I'd like to check the mobilization of your shoulder muscle. Adduction. Abduction. Medial rotation. And then lateral rotation. Flexion. No. Flexion and then extension. Good. The mobilization is good. Do the same thing. Flexion and extension. Adduction. Abduction. Medial rotation. And lateral rotation. Good. The mobilization is quite good. So, with the Mitchell testing, before Mitchell testing, I would like to do the cervical action. Oh, thank you for moving your body, make my job easy. And gently and contract. And gently and contract. I wouldn't do extension. With this, I'm going to check your functional assessed with the hip mobilization. Ready, flexion. I did the extension. It's okay, relax. Lateral rotation, medial rotation. Hip flexion, lateral rotation, and medial rotation. Knee tension and flexion. I already did it on the back side, so it should be okay. And also I did the adduction and abduction with the prone position already. So I'd like to do the check the toe deflection, both side, and then plantar flexion. And let me check with the fiber, deflection, abduction, and checking the level of the knees under 3 inches. Good. Thank you. And you see, this side has more gap than the other side, but it's still the normal range of the gap, but has more tightness on this side. On the left side than right side, I can notice about it. So with this, I do like to do the straight leg test to see if you have the muscle imbalance or ligament laxity. So I'm going to put my hands on ASIS. Will you be able to lift opposite side leg up and down? One more time. Up, slowly and down. Can you do the same thing on opposite side? Yes. Up, slowly and down. One more time. Slowly and down. Can you do one more time this side? So I noticed there's more popping on the other side. Compensate on the other side. So I'm going to try on the other side to see if it's the muscle imbalance issue or ligament laxity. I'm going to squish on this. Can you raise your leg on the other side? Because that one pop more SI joint.
Which side leg you want?
On the left side, please. And down. One more time. And down. With the first one, second one, which one was easier?
Which leg?
Oh, with the first section, doing your own self, and then second one, I squish your SI joint. The first one was easier, or second one was easier?
No different.
Oh, before you said second one was easier.
Different as your shoulder.
Yeah. So no different with the first one. That means she may not have ligament laxity or muscle imbalance, but I will still do the third test. So this time, because of on the left side of leg, I felt more of right side SI joint popping compensated. So I'm going to ask same thing. Put it on your shoulder. Can you lift your left leg, please? Slowly. Yeah. Can you do one more time? Okay. So with that one, was that more easier with 2 seconds squishing, or was that
That
more
was
easier
easier.
with the hands on your shoulder?
Mhm.
So hands on your shoulder means you don't have ligament laxity, it's just muscle imbalance. Left side of stiffness of the upper muscle, and also right side of the SI joint dysfunction, but she doesn't have a ligament laxity, it's more related to the muscle imbalance. So with her intake form, she didn't have any contraindication. She's pretty normal with everything, so it is okay to do the GOT and start the treatment. So with the global treatment, I'd like to do the GOT and then local for MET, muscle energy technique, and then for focal too, because of she has the deep circus up on the right side. I do like to do some correction with the deep circus correction. So with the GOT, especially on the right leg has issue, I'm going to do a little bit of the circumduction, 5 to 7 times. You can just relax, you don't need to move anything. 5 times, and then I'm going to do opposite side circumduction. Okay. This time I'm going to do the leg drop. How do you feel? Is it okay with the leg drop? So I'm going to do, I can feel a little bit more range of some increase of the range of circumduction. I'm going to do one more drop. How are you doing?
Good, good, thank you.
Third time. Here come with the last foot drop. Good. So I do like to do the hip and ET. So I can see she's emotion to the flexion is a little bit tight. So I'd like to do. Can you push on against my hand with the 10% of your strength? Push down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Now we'll go a little bit farther and do the same thing against my hands. Push it down your thigh. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then we do one more MET. I can see more range of motion improve. So can you do the same thing? Push against my hand. 10%. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. So I can see more improve of the flexion, and then I notice medial rotation is more tighter. So I'm going to ask you to external push against my hands with the 10% on this hand. 1, 2, push in that direction. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. So I can see more improve. So can you do the same thing with external rotation? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So more mobilization for the radial rotation. Let me do one more. Can you push against my hand? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. So there's more improve of the range of motion with the medial rotation. That's good. So for last focal treatment, will you be able to roll over, lie down on your tummy?
Face down.
Yeah, face down on your tummy. And then it'll be great if you come all the way down to the edge of the table. Good. So this time I'm going to stand between of your leg again. Is that okay with you?
Yeah.
Okay. So I'm going to open leg a little bit to lock it. And I found it on the right side deep circus. So I'm going to press on the deep circus. Will you be okay to turn your face to the right side? Turn your face to the window. Yes. Then I'm going to do light pressure on her deep circus. Can you take a deep breath slowly? Deep breath in, deep breath in, deep breath in, and deep breath out. Out, out. Good. Let's try one more time. Deep breath in, deep breath in, deep breath in, and whoo, deep breath out, deep breath out, deep breath out. That's good. Let's try last time. Deep breath in, deep breath in, deep breath in, and out, out, out. Good job. So I'm going to do the reassessment with the GOT and MET. I could see the improve of the range of motion. I'm just checking the correction of the deep circus. It's PSIS in, up, and I can see there is a level of the deep circus now. Okay, thank you. You can get up slowly, and will you be able to sit on the edge of the table? How do you feel?
Feel great.
That's great. So you have lots of tightness on the right upper leg, so I recommend you to do the home care. If you have the tennis ball or the massage ball, it'll be good to locate on your right hip, middle area,
Okay.
and then maybe just roll it to find your tenderness. And then if you find your tenderness of the hip, you may just sit on your weight, lying down on your back, and then hold it for 20 to 30 seconds until the muscle is releasing by the ball compressed by your weight. And then keep doing it, rolling, find another tender spot, set on it for 20 to 30 minutes, and holding it and let it release the muscle tightness will be good for good practice for doing it at home.
Thank you.
Thank